Hello! Welcome back! If you've been experiencing unusual cramps, fatigue, digestive discomfort, or simply wondering what your body is trying to tell you, know that you're not alone and you're not imagining things. Today, we'll address the signs of endometriosis in a clear, calm, and supportive way, so you can finally understand what's happening inside your body. Stay with us and, if it helps you, don't forget to like the video and subscribe to the channel so you don't miss our daily moments of learning and tranquility. Many women begin their journey with endometriosis, feeling confused by the wide range of symptoms they experience. One month the discomfort might feel mild and manageable, and another month it may feel overwhelming and disruptive. This inconsistency can make you question your own body or even doubt whether something real is happening inside you. It's important to understand that endometriosis is known for presenting itself in different ways in different people. For some, symptoms appear like clockwork around their menstrual cycle. For others, the discomfort feels random, unpredictable, and difficult to track. This variability doesn't mean your symptoms aren't legitimate. It simply reflects the complexity of this condition. Painful periods are often the symptom most people associate with endometriosis, but many women experience far more subtle signs, like bloating pelvic pressure, digestive changes, or a deep fatigue that is hard to put into words. These symptoms may appear gradually, becoming a familiar part of your month-to-month life, without you even realizing something might be wrong. Some women have almost no pain at all, which can delay diagnoses and leave them wondering why they struggle with fertility or unusual cycle patterns. Others experience significant pain, but hesitate to seek help because they've been told their symptoms are normal, or just part of being a woman. Your pain is never something you need to minimize or apologize for. The truth is that there is no single version of endometriosis. Every woman's experience carries its own nuances, patterns, and signals. What matters most is that you listen to your body, observe your symptoms, and trust that what you feel deserves attention. By acknowledging that your experience is unique and valid, you can take the first step toward understanding your body with clarity and compassion. This knowledge opens the door to better conversations with your doctor and a more empowered approach to your health. One of the most confusing parts of endometriosis is that it doesn't always follow a predictable pattern. You might not experience the severe menstrual pain that most people associate with the condition, and that alone can make you doubt whether endometriosis is even possible. But the absence of classic symptoms does not mean the condition isn't present. Some women have digestive problems that flare cyclically rather than intense cramps. Others report discomfort during specific activities, mild pelvic pressure, or unexplained fatigue that lingers throughout the month. These signs may seem unrelated at first, leading many to overlook their connection to endometriosis. Even healthcare providers can miss the diagnosis if the symptoms don't fit the traditional picture. This is why understanding the full spectrum of signs is so important. You may not feel pain during your period, but still experience discomfort during exercise, while going to the bathroom, or during ovulation, all of which may be meaningful clues. Silent endometriosis is also real. Women who have the condition but experience little to no noticeable symptoms. These women often discover the condition only when investigating fertility concerns or undergoing an unrelated medical procedure. Their bodies speak more quietly, but the condition is still present. It can be reassuring to know that a non-typical presentation is still valid. Your body does not need to follow a textbook for your symptoms to matter. You don't need to fit into a narrow definition to have your concerns taken seriously. By acknowledging the wide range of possible symptoms, you give yourself permission to explore answers without guilt or hesitation. Your experience, whatever shape it takes, is worthy of being heard. Many women spend years searching for answers before finally hearing the word endometriosis. The emotional weight of that journey can be heavy. You may have seen multiple doctors, tried various treatments, or wondered whether you were exaggerating your pain. This delay in diagnosis is incredibly common, and it is not your fault. Endometriosis often goes unrecognized because it can mimic other conditions. Digestive symptoms may be mistaken for IBS. Pelvic pain can be attributed to stress, muscle tension, or ovarian cysts. Fatigue might be dismissed as lifestyle-related. These overlapping symptoms can easily mislead even experienced clinicians. Because endometriosis varies so widely among women, it may take time before someone connects the dots. And that can feel discouraging, especially when you're trying your best to advocate for yourself. but the difficulty in diagnosing endometriosis reflects the complexity of the condition, not any failure on your part. You are not alone in this. Millions of women have walked this same path. Many have shared stories of being dismissed, misunderstood, or left without answers for far too long. Their courage has led to more awareness, better recognition of symptoms, and improved approaches to diagnosis. Today, there is more knowledge, more support, and more community than ever before. Healthcare providers are increasingly aware of the subtle signs, and women are speaking openly about their experiences, creating space for compassion and understanding. Even if the road to diagnosis has been long, your persistence matters. And now that you're learning more, you are closer than ever to receiving the clarity and care you deserve. Understanding the diagnostic process can bring a sense of calm, especially if you've been searching for answers. While many tests can point toward endometriosis, only a laparoscopy can confirm it with absolute certainty. This procedure allows doctors to see the lesions directly and evaluate their location and severity. Although the idea of surgery may feel intimidating, it's important to remember that laparoscopy is minimally invasive and has evolved significantly over time. It is performed through small incisions, with a tiny camera that gives doctors a clear view of what's happening inside your pelvis. For many women, this procedure is the moment they finally receive the validation they've been waiting for. Doctors often combine medical history, symptoms, and imaging to build a strong suspicion even before surgery. This means you do not need a laparoscopy immediately to begin a care plan. In many cases, treatment can start based on symptoms alone, bringing relief even before a definitive diagnosis is made. Some women undergo imaging like ultrasounds or MRIs, which can sometimes show ovarian cysts or collections that suggest endometriosis. Even so, these tools have limitations. A normal scan does not rule out the condition, and that knowledge can reduce unnecessary anxiety or self-doubt. It may help to know that laparoscopies today are safer and more precise than ever. Surgeons can not only diagnose, but also treat endometriosis in the same procedure, offering a sense of progress and hope. The most important thing is that you understand your options. A laparoscopy is one part of your health journey, and knowing what it offers can help you approach it with confidence and calm. Many women feel a wave of relief when their imaging results come back normal, followed quickly by confusion when symptoms persist. It's important to know that a clear ultrasound or MRI does not mean endometriosis isn't present. These tools simply can't detect the majority of the lesions this condition creates. Imaging is most helpful for identifying larger cysts or significant abnormalities, but endometriosis lesions can be small, flat, and difficult, even impossible to see on a scan. This is why so many women receive normal imaging results despite experiencing very real, ongoing symptoms. Hearing that your scan looks normal can be bittersweet. On one hand, it means there are no major visible complications. On the other, it can leave you wondering what's causing your discomfort. Who's to remember your symptoms are still meaningful, and your doctor should continue to take them seriously. Medical teams often use imaging to gather clues, guide decisions, and rule out other conditions, but they rely heavily on your symptom history and physical examination to understand what may be happening internally. Your voice is one of the most important tools in your diagnostic process. If your imaging results don't match what you feel, that's okay. Normal results do not erase your lived experience, and they don't close the door on exploring endometriosis further. By understanding what imaging can and cannot reveal, you give yourself permission to keep advocating and to trust your intuition when something doesn't feel quite right. Hearing anything related to fertility can be emotionally overwhelming, especially if you're hoping to grow your family someday. The good news is that many women with endometriosis conceive naturally. Having this condition does not automatically mean you will struggle with fertility. Endometriosis affects every woman differently. Some may have difficulty conceiving because lesions interfere with the ovaries, fallopian tubes, or pelvic environment. Others may have mild disease or silent disease that has little to no impact on their ability to get pregnant. Studies show that about half of women with endometriosis may experience fertility challenges, but that also means half do not. Those numbers can be reassuring, helping you understand that the condition does not predict your future. It simply gives you information you can use to plan thoughtfully. For women who do experience infertility, treatments today are more advanced and personalized than ever before. From egg freezing to assisted reproduction and surgical treatment, there are many pathways to parenthood. The most empowering part is understanding your options early. Knowing that endometriosis can evolve over time allows you to make decisions that align with your life goals, rather than reacting to surprises later. Your fertility story is uniquely yours. Endometriosis may be part of it, but it does not define it, and it certainly does not close the door to your dreams of becoming a mother. A diagnosis of endometriosis can feel frightening at first, but treatment options today offer more hope and precision than ever before. Over the last 2 decades, surgical techniques, technology, and specialized training have transformed the way this condition is treated. Modern excision surgery, for example, allows surgeons to remove endometriosis lesions more thoroughly than older methods like burning or ablation. Removing tissue at its root reduces the chances of recurrence and can offer long-term relief from pain. Robotic-assisted surgery has also become a powerful tool. With enhanced visualization and fine-tuned control, surgeons can navigate delicate areas with remarkable accuracy. This means safer procedures, shorter recovery times, and better outcomes for many women. Choosing the right surgeon is crucial. Not all specialists are deeply trained in endometriosis excision, and that's why asking questions is so important. You deserve a provider who has extensive experience and who makes you feel heard, supported, and respected. Understanding your surgical options gives you control. Whether you opt for excision, hormone management, lifestyle changes, or a combination of approaches, your plan should be tailored to your symptoms and personal goals. With today's advancements, treatment is no longer one-size-fits. You have choices, and each one brings you closer to relief, clarity, and a healthier future. Some symptoms of endometriosis are so unusual that women never imagined they could be connected to their reproductive system. Shoulder pain during menstruation, chest discomfort, or sharp sensations during exercise can be confusing and alarming, especially if they appear out of nowhere. These symptoms are rare, but they happen when endometriosis lesions form in unexpected places, such as the diaphragm or chest wall. When these areas become irritated, the pain can radiate to other parts of the body, often in ways that don't seem to make immediate sense. Digestive and urinary symptoms can also appear unpredictably. Cyclical bloating, constipation, diarrhea, or bladder pain might seem like unrelated issues, but they can be part of a bigger picture. When you understand the connection, it becomes easier to recognize when something feels off. Because these symptoms are uncommon, many women hesitate to mention them to their doctor. They may fear sounding dramatic or unrelated, but these small details can be meaningful clues that point toward a deeper explanation. Discussing these symptoms doesn't guarantee a diagnosis, but it opens a door to better understanding. Your doctor can evaluate patterns, ask questions, and consider possibilities that may otherwise go unnoticed. Nothing your body tells you is insignificant. When you honor your symptoms, even the unusual ones, you give yourself the chance to be seen, heard, and properly cared for. Navigating your health can feel overwhelming, especially when symptoms are vague or dismissed. But you deserve to ask questions, express your concerns, and advocate for your well-being. Your voice is one of the most powerful tools you have. Many women hesitate to speak up because they fear being judged or brushed aside. They assume doctors have all the answers and that their role is simply to follow instructions. But medicine is a partnership, and your perspective matters deeply in that partnership. Asking your doctor whether your symptoms could be related to endometriosis is not confrontational. It's proactive. It opens the door to conversations that may lead to clarity, better testing, or more personalized care. If you're considering surgery, questioning your surgeon about their experience is not only appropriate, it's essential. Understanding whether they specialize in excision or ablation can shape your treatment outcomes for years to come. Advocating for yourself also means seeking second opinions when needed. A fresh perspective can bring new insight, reassurance, or alternative options that support your goals. When you speak up for your health, you take an active role in your healing journey. You are not being difficult, you are being empowered. Learning about endometriosis can stir many emotions: relief, fear, confusion, validation. All of these reactions are normal. But with each new piece of information, something powerful happens. You gain clarity and control over your next steps. Understanding the condition allows you to make informed decisions about treatment, fertility planning, and long-term wellness. Instead of feeling like life is happening to you, Knowledge puts you back in the driver's seat. Many women find peace in knowing their options. Whether it's exploring lifestyle changes, considering medical treatments, or planning ahead for fertility preservation, having the information you need lets you choose what aligns with your life and values. This awareness can also help you recognize symptoms earlier, track your cycles more accurately, and communicate more effectively with healthcare professionals. The more you understand, the easier it becomes to navigate the complexities of endometriosis. Knowledge also brings connection. When you learn about your own body, you open the door to conversations with other women who may be experiencing the same thing. You become part of a community, one that shares, learns, and grows together. Your journey with endometriosis is unique, but you don't have to walk it blindly. With understanding comes confidence, and with confidence comes a sense of calm, hope, and purpose.